A 73 years old lady present with severe abdominal pain, and a laparotomy is performed. At operation, there is widespread necrosis of the small bowel, including the right colon. What is the most likely explanation for these findings? So, first of all, a lady who is 73 years old present severe abdominal pain, and when laparotomy performed, here we can see the widespread necrosis of the small bowel and the right colon. What is the cause of it? Here the options are mesenteric vein thrombosis, acute embolism affecting the superior mesenteric artery, acute on chronic thrombus of the superior mesenteric artery, subintimal dissection of the superior mesenteric artery, and proximal migration of the abdominal aortic aneurysm. So first of all, let's see the blood supply of the whole of the small intestine and right colon. Here we can see from here up to here, this is supplied by this blood artery, which is the superior mesenteric artery. So the superior mesenteric artery, it supplies or it gives branch to the duodenum, it gives branch to the jejunum, it gives branch to the ileum, appendix, cecum, ascending colon, also the right two-third of the transverse colon. So there is the pathology within this superior mesenteric artery. Here we can see the another artery, which is the inferior mesenteric artery, and this inferior mesenteric artery, it supplies the left colon, sigmoid colon, and rectum. And this is the acute mesenteric embolus. In case of acute mesenteric embolus, what occurs? There is sudden onset of the abdominal pain followed by the diarrhea. So this is the acute mesenteric embolus, may be associated with vomiting sometimes and rapid clinical deterioration, and the traditional painkiller usually not acts. What are the serological tests? White cell count, lactate, amylase may be abnormal. This can be normal in early phases. And acute embolic events account for about 50% of the case. So it is a big amount. And it occurs as a result of atrial fibrillation, ventricular aneurysm, and post-myocardial infarction. That means when there is compromisation of the heart, in this condition, there is chance of development of the embolus, which may affect the superior mesenteric artery. So what is it? The acute severe abdominal pain, and there is widespread necrosis of the small bowel and right colon. It is due to acute embolism affecting the superior mesenteric artery. Other options here, they are not suggestive, because acute on chronic, in case of acute chronic, there is a chronic history or repeated history. Subintimal dissection of superior mesenteric artery, it usually not occur. Proximal migration of the abdominal aortic aneurysm, it is also not true, because it cannot affect the superior mesenteric artery flow. Mesenteric venous thrombosis, it also not true. So our option is the acute embolism. Actually, when there is severe abdominal pain and which is not responding to the traditional painkillers, then it should be think that it would be a acute mesenteric ischemia. Thank you all.